Wir haben ja schon mal zu Dr. Mike, Dr. Michael Warschawski, haben wir schon mal reacted gehabt. Das war aber das Folgevideo auf das hier, glaube ich. Also das war das aktuellere. Das hier ist das erste Video, was er gemacht hat zu den Simpsons, zu Medical Scenes. Das gucken wir uns jetzt auch mal noch an. Ich habe letztes Mal nur das andere angezeigt bekommen und das hier nicht. Aber das wurde mir dann im Nachhinein, habe ich es doch noch gefunden. Also das hier ist quasi vor dem anderen, aber von uns nach dem anderen.
Well, isn't that odd?
Okay, we watched the medical dramas, we played the games, but now it's time to take a...
Was ist Minecraft? Was war denn das? Was war das für Game? Das ist doch Minecraft.
But now it's time to take a look at one of the most successful animated series of all time, The Simpsons.
Clear. More.
Why are they shocking everybody? Even in the cartoons, they take it from the medical dramas and they're shocking everybody. Chest compressions if their heart is stopped and they're not breathing. And my man's going, more. Well,
we can't fix his heart, but we can tell you exactly how damaged it is.
What an age we live in.
It's classic in medicine where we don't have all the solutions and people right away start saying, oh, medicine sucks. Well, how come we don't have this? Maybe you're just a doctor that doesn't know what the cure to this problem is. No, the human body is very complex. And while we know a lot about it, there's still a lot more left to learn.
Now, Homer, this is a new body fat analysis test. I start you jiggling and measure how long it takes.
Oh, das ist so gut, die Szene. Das fühle ich aber auch, das ist bei mir auch so leider, glaube ich.
To stop.
Caliper test, weightless pool test for body fat percentage, punch in the gut test in The Simpsons.
Mr. Simpson, I'm afraid you have a crayon lodged in your brain.
There's a crayon in my brain? I've had thousands of head x-rays. How come no one ever noticed it before?
Oh, I can answer that.
Oh, nee. Ich bin manchmal, was er dazu sagt. Ob ihm das auch schon mal passiert ist.
See, whenever I pick up an x-ray, I always hold it like this. My thumb must have covered up the crayon.
When you look at an x-ray, you have to look at many things, including the issue at hand. So if a person has shortness of breath, you want to look at the lungs. You also want to look at the surrounding structures, because the last thing you want to do is look at an x-ray to see if the patient has a pneumonia and miss the cancer that's growing in their humerus, or on their rib, or on their clavicle.
This place seems even nicer than...
Okay. Das können wir schon mal mit auf die Liste nehmen. Man soll Röntgenbild ganz angucken.
the Mayo Clinic.
Mayo Clinic, eh?
Should we slice them diagonally or just cut off the crust?
Why is it called the Mayo Clinic? It's gotta be because there was a doctor that started it with the last name Mayo. It has nothing to do with mayonnaise.
Founders Charles and William Mayo.
Look at that. It's like I went to medical school and all.
This whole morning has been
Mayo, das ist so eine richtig teure, oder? Also was ist denn das? Ich glaube, das ist so eine richtig teure Klinik. Das gibt's doch auch, als wir in New York sind, glaube ich, geht es da doch auch um die Mayo Klinik. Also dieses Musical, wo sie dann später besuchen, das geht, glaube ich, auch um die Mayo Klinik.
wonderful. Too wonderful. It shot me!
There's actually a really adorable video of like a doctor who does this whole like show for kids with the needle to get them excited about it, and then like fake injects himself and then injects the child, and then they don't even feel the pain because there's so much going on. For kids who are able to reason somewhat, I try and talk to them as if they're adults. I bargain with them and I say, I'm gonna give you, you know, this really cool pillow. And they're like, why do we want a pillow that looks like you? And I'm like, true. And I get them something else that is furry and cute and soft like Bear. Or I give them stickers of their favorite shows. And they're like, oh, that's awesome. What are we doing today? I'm like, well, today you're gonna get a vaccine, a shot. Here's why, blah, blah, blah. They're like, okay, that sounds fair. You gave me a sticker and a weird pillow, so you must be nice. I give them a quick shot. I'm very gentle. We're very good with it. My nurses are amazing. And then they leave happy. Hibbert Money Making Organization. Is that what HMO stands for this whole time?
I can provide every medical
Was ist ein
service
HMO? Was ist das?
you'll ever need under one roof.
Rub a palm full of this medicated salve into your scalp every half an hour. Keep him away from open flames and pregnant women.
These should help those fallen arches. Enjoy. Throat looks a little red. I better spray it.
Oh my god, this is my favorite skit ever. And I feel like it has less to do with HMOs, but in general the
Health
fact that
Maintenance, okay. Sehr gut, danke. Weil ich wollte gerade googeln, also ich wollte googeln nach dem Video, aber Das hat sich erledigt, sehr gut.
People in our society have grown up with this theory inside their head that they need to see a specialist in order to stay healthy. And it's so not true. Because specialists oftentimes deal with really complex cases, they treat things a little bit more aggressively than your family medicine or your primary care doctor would. Please don't think you need to see a specialist for everything, because A, that will happen. B, many things will go away on their own, and you don't need to spend a whole ton of money to see a specialist in order for that to happen. And C,
gut, das ist bei uns nicht der Fall.
Your primary care doctor is well versed in solving all these problems. And not only are we well versed in solving them, we know you best because we have an existing relationship.
Now, doctor, I want you to test me for everything. Every disease on this chart.
Oh nee, das wo er keine Vene findet, das finde ich voll eklig. Dass er da durchsticht. Oh, das finde ich eklig. Das fand ich schon immer eklig.
Well, isn't that odd?
Okay, I'm gonna hit Simpsons hard with the medical inaccuracies. We do not stab patients with a syringe and have it come out the other side of their arm and be like, oh, I guess it's not working. We do not just check for a bunch of diseases. When you come in for a checkup, part of that is figuring out what diseases we can actually screen for. There are some, like cancers. What diseases we can prevent. We could also look at what risks you face. So get this, a patient comes in, doesn't have liver disease, but they talk to me honestly, we have a good conversation, and finds out they're drinking 1.5 bottles of vodka a day. It's a lot, but some people do this. We have a conversation about, A, what can we do to prevent them from drinking and driving? What we can do for them preventing themselves causing harm in other ways to themselves when they are inebriated. How can we get them to cut down the amount that they're drinking so they can stay healthier longer? Look at how much I've affected their lifespan, the progression of disease.
Ich glaube, ein Arzt ist nicht dafür verantwortlich, dass Leute nicht trinken oder nach Auto fahren. Ey. Macht's einfach nicht. Das ist eigentlich gesunder Menschenverstand und muss nicht von einem Arzt erklärt werden. Das sollte einem auch ohne jegliche Erklärung eigentlich klar sein.
Disease simply by having a good conversation. That's what you should expect from a doctor when you go in for a physical. And if you get anything less than that, please look for a second opinion.
Mr. Burns, I'm afraid you are the sickest man in the United States. You have everything.
You mean I have pneumonia?
Yes.
Juvenile diabetes?
Yes.
Hysterical pregnancy?
A little bit, yes. You also have several diseases that have just been discovered.
First of all, how does he have juvenile diabetes? He's not of juvenile age.
This sounds like bad news.
Well, you'd think so, but all of your diseases are in perfect balance. Here's the door to your body, you see? And these are oversized novelty germs. That's influenza, that's bronchitis, and this cute little cuddlebug is pancreatic cancer. Here's what happens when they all try to get through the door at once. Move it, shout ahead. We call it Three Stooges syndrome.
No, if you have a lot of diseases, it's not better than having less diseases. Also, if you're a good doctor and a lot of tests come up positive, you need to start looking for a cause that perhaps ties in all of these diseases together. I don't just say, hey, you got a bunch of diseases, deuces.
There's a crazy man with a scalpel in ER. He's demanding to see a quack.
Hi, everybody. Now, tell Dr. Nick where is the trouble.
So krass, dass der so einen Akzent hat, ne? Das ist so krass, dass der in Deutschland gar nichts hat.
Gee, I got ants in my pants. I'm discombobulated.
Warum wird der eigentlich nicht gecancelt? Warum ist Apu rausgeflogen, aber nicht der schlechte mexikanische Arzt, der alle verhunzt, weil er keine Ausbildung genossen hat? Das verstehe ich auch nicht so ganz. Oder ist Dr. Nick noch dabei oder ist der mit rausgeflogen? Weiß ich nicht.
Give me a calmative. Slow down, sir. You're going to give yourself skin failure.
What is skin failure? I think skin failure is just when your skin just gives up and starts sloughing off. Steven Johnson syndrome.
Disorder of the skin where the top... Ich hatte Sonnenbrand im September und da hat sich's geschält. Das war schon ganz schlimm. Aber das, do not Google, nee, Steven Johnson.
Insert the retractor and crank it until the ribs swing open like a rusty drawbridge.
No! Blood!
Silly, but truth to it. We do watch videos on procedures all the time, and that's a good thing. You want your doctor up to date and seeing the procedure before they do it. Even if they've done it multiple times, that little refresher goes a long, long way. And you know where we do a lot of it? YouTube. Your doctor watches YouTube before they perform surgeries on you. That's the truth.
These gloves came free with my toilet brush.
Usually you have someone help you with the gloves, have the package open, because remember, the inside of the package is sterile, but the outside is not. So there's a specific way you actually have to put the gloves on to make sure that you're keeping sterile.
What the hell is that?
That's something you don't want to hear from your surgeon. That and oops.
I know I'm supposed to cut something, but what? And where?
The mask is not part of the sterile field, so if you make contact with your mask right away, you have to leave, change gloves, re-scrub in, and do the whole process all over again. So my man is not sterile no more.
Dr. Nick Riviera. Remember me?
Well, if it isn't my old friend, Mr. McCraig, with a leg for an arm and an arm for a leg.
The only question I have after watching that is, what is that doctor's specialty? Dr. Nick, what do you do?
Alles. Alles, Dr. Mike. Dr. Nick kann alles.
Simpsons, all in all, does a great job of teaching you medicine, albeit satirically, but as you've seen with the Onion episodes in the past, I don't mind a little satire. And speaking of the Onion, check out my Onion review here and my Saturday Night Live medical skit reviews. Which one are you clicking? Which one are you enjoying? And as always, stay happy and healthy.
Danke, Dr. Mike. War wie immer eine Freude. War super. Und die Simpsons sind nach wie vor nicht sehr akkurat, aber doch sehr gut, was Medizin angeht. Falls ihr gerade im Medizinstudium seid, falls ihr irgendwelche Pflegekräfte seid, holt euch eure Tipps nicht von den Simpsons. Das gibt es andere Quellen. Aber danke fürs Zuschauen und lasst ein Abo da und ein Like. Bis zum nächsten Video. Ciao.